People don't go to the doctor unless they have a symptom, right? I mean, you never really go to prevent a problem or get healthy. It's after you have probably multiple symptoms. And so a symptom is your body's way of telling you there's a problem. So these communications back from your body are valuable. But the problem is, especially if we're talking about the kidney, is most of the time there is no sign or symptom that you have a kidney problem. So when we talk about early kidney disease or even early liver disease, there's no symptoms whatsoever. Unless you do a urine test where you find protein or the filtration of the kidney is being interrupted, you don't really know if you have a problem. But as the kidney progresses and gets worse, when it goes through the different stages, stage 1, 2, 3, 4, and then eventually 5, there are indicators or symptoms that you need to know about. And I'm going to cover those right now. But for a lot of people, they actually have a kidney problem and they don't even know it. Okay, so let's go through these symptoms just to increase your awareness so that way you can do something about it. The first one is fatigue easily. Okay, you get weak and tired very easily. I mean, you can get tired with exercise, but I'm talking about normal daily activities. Number 2 is periorbital edema, puffy eyes. That means your kidneys are backing up with fluid. It's backing up to the lymphatics and it's showing up in the eyes. Boy, you know, when I'm out in public, sometimes I'll see people with that and I'm really tempted to come up to them and mention that, but I have to withhold myself. But once you know the look, you'd be surprised how many people have that and don't even realize what it is. I guess the more I think about it, I think it'd be kind of weird going up to someone and say, have you ever been checked for periorbital edema? They might look at you kind of funny. All right, number 3, edema or swelling in your lower legs or your feet. This has to do with the kidneys losing protein. And anytime there's a protein imbalance in the body, you're going to retain fluid around your cells. And because gravity pulls things down, you're going to see this in the lower ankles and the feet. In fact, when you press into your ankles, you'll see that pitting edema, which is pretty wild to know that I had pitting edema years ago in my early 30s. I remember pressing into my ankle, looking at it going, what the heck is going on with that? Now I don't have any pitting edema. Back then I did. The next one on the list is you're urinating at night more than during the day. Now that can come from diabetes or pre-diabetes or insulin resistance, which a lot of people have and don't even know they have it, is one of the main causes of a kidney problem. So that's in the background. And just as a side note, I did a video on frequent urination, especially at night. And there are so many people that experienced great results in getting rid of that condition by changing their diet. And I will put that video down below. Now, the next one is foamy urine. Kind of like if you just, someone poured a glass of beer, right? And you see that foam at the top. That is protein in the urine. All right, next one is high blood pressure. Now, high blood pressure can come from several things. It can come from a nutritional problem. It can come from diabetes. It can come from a heart problem. And it can come directly from a kidney problem because there's kidney damage. All right, the next one is you feel nauseous, especially in the morning when you wake up, sometimes to the point where you want to vomit. Now, that probably is going to happen a little bit later in the stages of kidney disease, but you're going to notice that in the morning, you feel kind of sick. And that is because all night, all this toxic waste is being building up in the body, and those toxins haven't been released yet. So they're kind of backing up into the system. All right, and then the next one is the metallic taste in your mouth. What is that? That is basically toxins backing up to your system, and it's coming out to the pores in your mouth. There's another condition called uremic frost, where your sweat glands are eliminating uric acid crystals, and now it's coming out to the skin. So you'll see this kind of like a white frost on your skin. That is a really specific indicator that there's a kidney problem, especially with protein metabolism. All right, and then the last one is a loss of appetite. And that probably goes along with, you know, the metallic taste in your mouth and the nauseousness. But just because you lose your appetite doesn't mean that it's a problem. Like if you go on the ketogenic diet where you're doing fasting, you're going to lose your appetite as well. But if you have this sudden loss of appetite, you might want to get your kidneys checked. So there's various stages of kidney damage. You have 1 through 5. And when you get to 5, the only solution is either a kidney transplant and or you're on dialysis. I mean, you're talking many times a week going to this clinic. You're spending hours there getting your kidney filtered. It's devastating. And the current medical treatment for kidney disease is that they're basically managing certain things because they use medication, and medications are toxic. So the more medication that you give the kidney or even the liver, the worse the problem is. So there's not a really good solution medically for advanced kidney disease. It's just all about managing. So they're going to manage blood pressure. They're going to manage your diabetes and your diabetic symptoms. They will probably give you a medication for edema or swelling, like hydrochlorothiazide, which is a blood thinner. And if you're type 2 diabetic, you're probably going to be on metformin. And if you have high blood pressure, they probably will give you like an ACE inhibitor, something like that. Now, since there are multiple causes of kidney problems, you would want to address the underlying cause. So if it is diabetes, that's the area you need to focus in on, not the symptom of a kidney problem. If your kidney problem is coming from an infection, of course, you're going to focus on that. But I want to give you some natural alternatives to certain medications you're taking. Of course, check with your doctor before implementing this. But let's first start with high blood pressure. From a nutritional standpoint, the two things that are usually always deficient are number one, potassium, and number two, vitamin D. So by taking potassium and vitamin D, you can many times lower blood pressure. Now that brings up the topic of potassium. You probably have been told that potassium is dangerous for the kidney. So people tend to avoid it because if you get high levels of potassium called hyperkalemia, then there's a risk of arrhythmia problems and all sorts of other heart problems. Now check out this interesting research paper that talks about potassium and chronic kidney disease. It says potassium often has a negative connotation in nephrology, as patients with chronic kidney disease are prone to develop hyperkalemia. That's that high potassium. Yet emerging data indicate that dietary potassium may be beneficial for patients with chronic kidney disease. Studies have shown that a higher urinary potassium excretion is associated with low blood pressure and lower cardiovascular risk, as well as better kidney outcomes. Moreover, increasing dietary potassium intake can exert blood pressure independent effects on the kidney by relieving the deleterious effects of a low potassium diet. Inflammation, oxidative stress, and fibrosis. So when you're low in potassium, you get more inflammation, you get more oxidative stress, and you get more fibrosis. The three things you don't want when you have kidney problems. So there are a lot more studies that talks about potassium being protective on the kidney. So sometimes when people hear things out of context, like if you have stage 5 kidney disease, then of course, you can't regulate potassium. So that's going to be toxic. But what if you have stage 4 or stage 3 or stage 2? So some people take this idea that it's bad for end stage kidney disease and say it's bad for any type of kidney problem, which is absolutely not true. I mean, phosphorus is very, very damaging to the kidney if you're stage 5. So should we also avoid anything with phosphorus, even if our kidneys are not that bad yet? You see, consuming potassium as a supplement or electrolyte powder, or consuming foods high in potassium won't cause kidney problems. They will not cause hyperkalemia, which is high potassium in the blood, because your kidneys, if they're healthy or if they're working somewhat, can regulate that and get rid of any excesses that you have. The other piece of the puzzle is this. Our bodies require tremendous amounts of potassium even to maintain a healthy body. Out of all the different nutrients there are, potassium is needed in the highest amounts, like 4,700 milligrams every single day. So if you're starting to get some symptoms with the kidney and you start cutting back on potassium, what's going to happen is you may have more inflammation, more oxidative stress, more fibrosis, and you're going to have higher amounts of sodium because potassium and sodium work together. And potassium can help alter the pH of your body so your body's not too acid or too far on the pH scale. Let's just touch on pH for a second. So we have this pH scale, right? This acid alkaline scale. Right in the middle of the scale is 7, which is neutral. Anything above 7 is more alkaline. Anything below 7 is more acidic. This scale goes from 0 to 14. And it just so happens that the urine has the highest or widest range of pHs. It can be from 4.5 all the way up to 8, versus other fluids in the body have a much more narrow range, especially with your blood, which should be slightly alkaline. So one of the big purposes of the urine is to ensure that the blood pH stays at that real narrow range, 7.4. So your kidneys are constantly dumping off certain things to adjust this pH. They'll lose like bicarbonates or calcium, which are alkalizing agents, or they'll dump acids to help balance this pH. So typically the urine should be slightly acidic, but if it's strongly acidic, let's say it stays at a 5, there are certain indicators that you could have potential kidney problems down the road. But there's some mixed studies on that topic. But let me just go through a couple things with pH. So if someone's a diabetic, they're typically going to have more acidic urine than someone that's not a diabetic, especially if they forget to take their medication and there's this out of range blood sugar situation. Now, on the flip side, if you have a UTI, a urinary tract infection, your urine will tend to be alkaline. What's happening there is you have this bacteria, which is making more ammonia, which happens to be very alkaline. It's not acid. Now, when you're dehydrated, you tend to have more acidic urine. And the more chronic renal failure you have, actually, the more alkaline the urine's going to be, which is, you would think it'd be more acidic, but it's going to be more alkaline. Now, during times of starvation, your urine is going to be very acid. And also when you do fasting, your urine is going to be more acid because you're burning up your fat, releasing ketones, which are acidic. So you can have something really bad like starvation or something really good, fasting, and have an acidic urine. So by having an acidic urine, you can't really tell what's going on. It's just one of the clues that you need to associate with a lot of other clues, like a history. When someone typically consumes a very heavy meat diet with nothing, no vegetables to alkalize that, they'll tend to be more acidic, versus someone who pretty much just eats vegetables and doesn't have any animal protein, they'll be more alkaline. And as far as kidney stones go, your pH could be either alkaline or acidic because there are different stone formations that can occur. Like, for example, uric acid stones or even calcium oxalate stones form more in an acidic urine, or calcium phosphate stones occur when you have an alkaline pH. I'm just trying to increase your knowledge on pH because you can't just automatically like say, oh, I'm going to change my pH to help my kidneys. You have to really understand what's going on behind the scenes. I mean, I'll give you an example. Someone bought one of those machines that alkalize water, right? And so they were drinking this water, which was artificially alkalized. And I checked their urine pH at my clinic, and their pH was a 9. Like, that's like extremely alkaline. And typically you think that's a healthy thing, but you're artificially changing the pH of the water without really understanding what's going on in the rest of the body. If you eat healthy and you become healthy, your pH will go to exactly what your body needs to handle whatever. But to force your body into one pH isn't always a good thing. But let's say, for example, you don't have stage 5. Let's say you have some kidney problems and your pH is pretty acid. There are things you can do. Potassium is one thing you can add, especially if you're prone to those kidney stones, the most common ones being calcium oxalates, which develop in an acid environment. And if you have gout and you have these uric acid crystals, by alkalizing the body with potassium, you can actually improve the symptoms. And I like potassium because it also can protect the kidney. Now, there's also baking soda. You can take a little bit of that to help protect the kidney, especially if there's like a high blood pressure situation and your pH is too acid. But realize that baking soda is high in sodium, okay? So sodium is one of those things that they're telling you to avoid because of the blood pressure problem. But if you have enough potassium there to counter that, you should be okay. Now, I started to talk about some alternatives for high blood pressure medication, like potassium and then vitamin D, right? Well, there's other things as well. Garlic is a natural ACE inhibitor, but without the side effects. Lion's mane mushroom is another natural ACE inhibitor. And pycnogenol is also a natural ACE inhibitor. When we get to diabetes, cinnamon is a potent spice that can help not just bring down your blood sugars, but your insulin as well. People who have diabetes who take cinnamon need a little less medication because it helps your blood sugars. Apple cider vinegar is another great way to help regulate blood sugars. And going on keto and intermittent fasting could ultimately correct type 2 diabetes. Because what is diabetes? Too much sugar in your bloodstream. What is keto and IF? The reduction of carbohydrates in the diet. So that's kind of a no-brainer. Now, when we get to edema, whether it's around your eyes or in your ankles, potassium is a natural diuretic because it can help push out the fluid and it counters the sodium and the water retention problem. But as you can see, potassium keeps coming up as a good thing, as a kidney protector for edema and even high blood pressure, which is the exact opposite thing that people generally think. Now, one of the things about going on the ketogenic diet and doing intermittent fasting, especially together, is that you dump a lot of excess fluid. On average, about 13 pounds of fluid within the first 1 to 2 weeks, because there's no need to hold or store that much stored sugar called glycogen anymore. And so when the body dumps the stored sugar, it also dumps the water that's connected to that sugar. And lastly, there's a really great Indian herb for chronic kidney disease, as well as fluid retention and edema. And that herb is called punanava. And lastly, one of the most important preventative things you can do for kidney problems is getting on the right diet. And I'm talking about the healthy version of keto with intermittent fasting. And I put the best video I have that will walk you through step by step how to do it correctly right here.